Let's get to some of these numbers here. It just seems that it's so much more serious involving our kids than it was a year ago, even the beginning of the year. From June to mid-August, hospitalizations increased 5 times in children and adolescents from June to mid-August. So what does that tell you? It's the Delta, it's the summer, kids getting together, all of those?
Yeah, probably a combination. I mean, right now, almost 100% of cases across the country are the Delta variant. It is highly, highly contagious. Now, that being said, it is not necessarily more dangerous in children, but it seems to have a predilection for the younger age groups. Now, that may be a result of a large adult population being immunized now, and they're not getting as sick as easily. What's scary and why the masking, as we tied in before, comes into play is we found that this virus is able to penetrate the vaccine to some degree, those breakthrough cases we talk about. So when we hear all the rush about why are we remasking, we're vaccinated, it's because last year or over the at the beginning of the summer we weren't dealing with Delta. In our school district in East Meadow, we removed the mask for summer school. We had no issues, but as the end of summer school came along, we started seeing Delta. We had to remask the kids because we were concerned about breakthrough.
Okay, so Delta is not more serious. Now, we're talking about both adults and kids here, right? Delta's
Generally not more serious. It does seem to infect children easier, and that may be part of what we're seeing is why the kids are ending up in the hospital.
Okay. What are some of the are there different symptoms in let's say teens and youth versus adults?
Yeah, not necessarily. It's again a respiratory disease, so we see those upper respiratory congestion, fever, body aches. But what we're finding is it's a more rapid onset. It seems to be 48 to 72 hours from time of exposure, and it does seem to lead. At least I've had, we were talking before the show. In the last 18 months, I've not hospitalized any children that had the regular variant. They were managed at home. We had a lot of kids sick. In the last 2 weeks, I've had 3 adolescents end up in the hospital with severe respiratory symptoms. I mean, pneumonias from this. So this is a little frightening, and this is kind of what we're seeing across the country. It's putting more and more kids in the hospital a little faster.